Malaria is a serious disease. It affects millions of people worldwide. This disease has plagued humanity for centuries. Its impact is most felt in tropical and subtropical regions. Malaria is a silent killer, especially among young children. Imagine a tiny mosquito bite causing a life-threatening illness. That's the reality of malaria. However, malaria is a preventable and treatable disease. Understanding its causes and modes of transmission is crucial. We can protect ourselves and future generations from this deadly disease. Malaria is caused by a parasite called Plasmodium, a microscopic organism that has a complex life cycle. This parasite finds its way into our bloodstream through the bite of an infected Anopheles mosquito. Once in the bloodstream, it travels to the liver, where it finds a suitable environment to multiply rapidly. Imagine a tiny army of invaders setting up camp inside your body, silently growing in numbers. That's exactly what the Plasmodium parasites do in the liver, setting the stage for the next phase of their life cycle. They multiply and transform into another form called merozoites, which are even more dangerous. These merozoites then target red blood cells, the cells responsible for carrying oxygen throughout our body. They invade these cells and multiply further, causing them to burst and release more parasites into the bloodstream. This cycle of infection, multiplication, and cell bursting leads to the symptoms of malaria, which can be severe. The synchronized bursting of infected red blood cells triggers a cascade of fever, chills, and other debilitating symptoms, making the patient very ill. It's the body's way of fighting the infection, but the immune response can be overwhelming and sometimes life-threatening. Malaria is spread through the bite of infected female Anopheles mosquitoes. These mosquitoes become carriers of the Plasmodium parasite after feeding on an infected person. When an infected mosquito bites a healthy individual, the parasite enters their bloodstream. This transmission cycle continues, spreading malaria from person to person. While mosquito bites are the most common mode of transmission, malaria can also spread through other means. These include blood transfusions, organ transplants, and from a pregnant mother to her unborn child. Understanding the role of mosquitoes and these other transmission routes is crucial for effective malaria prevention. Diagnosing malaria promptly is crucial for effective treatment. Doctors use various methods to detect the presence of the parasite in the blood. Microscopic examination of blood smears is a common diagnostic technique. This involves examining a drop of blood under a microscope to identify the parasite. Rapid diagnostic tests, or RDTs, are another valuable tool. These tests detect specific antigens produced by the malaria parasite in the blood. Results are available within minutes. These diagnostic methods help healthcare professionals confirm the presence of malaria and determine the appropriate treatment strategy. Early diagnosis increases the chances of successful treatment and reduces the risk of complications. Section 5. Fighting back treatment of malaria. Malaria treatment involves using antimalarial drugs to kill the parasites in the blood. The type of medication and treatment duration depend on various factors. These factors include the species of the parasite, the severity of the infection, and the patient's medical history. Early diagnosis and prompt treatment are essential for a successful recovery. In some cases, hospitalization might be necessary to manage severe complications. Supportive care, such as managing fever and maintaining hydration, is crucial during treatment. The good news is that with effective treatment, most people make a full recovery from malaria. However, it's crucial to complete the entire course of medication as prescribed. Section 6. Shielding ourselves, malaria prevention strategies. Preventing malaria involves a multi-pronged approach targeting both the mosquito vector and human infection. This means addressing the problem from multiple angles to ensure comprehensive protection. One crucial aspect is reducing mosquito breeding grounds. Mosquitoes lay their eggs in stagnant water, so eliminating these sources is vital. This can be achieved by eliminating stagnant water sources, using insecticide-treated mosquito nets, and spraying insecticides indoors. These actions disrupt the mosquito life cycle and reduce their numbers. These measures help control mosquito populations and reduce the risk of bites. Installing window screens and spraying outdoor areas are also effective strategies. Personal protection measures are equally important. Using insect repellents, wearing long-sleeved clothing, and ensuring that exposed skin is covered can provide an additional layer of defense. Avoiding outdoor activities during peak mosquito hours, typically at dusk and dawn, can significantly reduce the chances of getting bitten. Closing windows at sunset also helps keep mosquitoes out. Another critical aspect of malaria prevention is chemoprophylaxis. This involves taking medication to prevent malaria infection before it starts. This involves taking antimalarial medication to prevent infection, especially for travelers visiting malaria-endemic areas. It's a proactive step to safeguard health. Especially for travelers visiting malaria-endemic areas, taking these medications can be a lifesaver. Consulting a healthcare professional for personalized advice is essential. They can provide guidance on the best prevention strategies tailored to individual needs and travel plans. Section 7. The unseen dangers. Complications of untreated malaria. Untreated malaria can lead to severe complications, some of which can be life-threatening. The disease, caused by Plasmodium parasites, can wreak havoc on the body if not addressed promptly. As the parasite multiplies in the blood, it can affect vital organs, leading to organ failure. This can include the liver, kidneys, and even the brain, making it a critical condition. Severe malaria can manifest as cerebral malaria, causing seizures and coma, which can be fatal if not treated immediately, or severe anemia due to the destruction of red blood cells. This condition can lead to extreme fatigue, weakness, and in severe cases, heart failure. Other complications include kidney failure, respiratory distress, and low blood sugar. These conditions require intensive medical care and can have long-term health impacts. Pregnant women are particularly vulnerable, as their immune systems are compromised, making them more susceptible to severe forms of the disease. Malaria during pregnancy can lead to miscarriage, premature birth, and low birth weight. These complications can affect both the mother and the baby's health. It's crucial to seek immediate medical attention if any malaria symptoms develop, especially in high-risk individuals such as young children, pregnant women, and those with weakened immune systems. Timely treatment is crucial to prevent these complications and ensure a positive outcome. Early intervention can save lives and reduce the burden of the disease. Public health programs focused on early diagnosis, prompt treatment, and effective prevention strategies are essential in the fight against malaria. These initiatives can help reduce the incidence and severity of the disease, protecting vulnerable populations. Section 8. Winning the war. A summary and call to action. Malaria remains a significant global health threat, but it's a battle we can win. By understanding the causes, modes of transmission, and available prevention and treatment strategies, we can protect ourselves and our communities. Simple yet effective measures like sleeping under insecticide-treated nets, using insect repellents, and seeking prompt medical attention can make a world of difference. Early diagnosis and treatment are crucial for preventing complications and saving lives. Let's continue to support research efforts aimed at developing new and innovative tools to combat malaria. Together, through awareness, prevention, and timely treatment, we can strive for a world free from the burden of this deadly disease.